Hey guys, welcome back. This is Dr. Kanan Jhaveri, consultant OBGYN, obstetrician and gynecologist, and a mom to two kids. Today I'll be talking about PCOS, Polycystic Ovarian Syndrome, a few lesser known facts. So, PCOS is today the most common chronic reproductive and metabolic endocrine disorder. Its incidence is 4 to 21% worldwide and is constantly rising. So, all of us have heard about PCOS, but we always talk about it in terms of, our periods or ovaries or reproduction. And I often hear just one thing: I'm not getting my periods regularly. I get my periods only if I take medicines. My periods are delayed. I get them every 2 or 3 months, and so on. But do you know PCOS actually affects your entire body in very terrible ways? And today, I'll be talking about those things like your entire body that we don't often realize. So, let me start with metabolic syndrome. What is metabolic syndrome? I will say a few names over here: obesity, dyslipidemia, that means altered cholesterol levels or lipid levels in your body, then increased blood pressure, hypertension, insulin resistance, or bad sugar metabolism of your body, then over diabetes mellitus and heart disease, cardiovascular disease, and so on. So this collectively everything is called metabolic syndrome. Basically, it's affecting the metabolism of your body. Now let me address each thing. So obesity, very common, found in 80% patients of PCOS. And this is more of central obesity, that is more fat concentrated in the abdominal area. Now, a very common symptom associated with obesity is obstructive sleep apnea. You might not have realized this, but what happens for obese patients during their sleep? Their airflow or the windpipe gets partially or completely blocked, and you get episodes of apnea, that is complete cessation of breathing. So what happens is your oxygen levels in the body, they go down, they are low, and your brain wakes you up, get up, oxygen getting low, and you wake up and you breathe conscious, and this keeps going on through the entire night. So you have multiple episodes of awakening, and as a result you don't get a good sleep. And what happens during daytime is you feel very lousy, you feel sleepy, you don't like to do anything, you're not fresh. So this is obstructive sleep apnea. And when you talk about PCOS, then obstructive sleep apnea is 30 to 40 times more common in PCOS patients when compared to the weight-matched obese controls, right? Next, a very common thing, a physical sign that appears on our body is acanthosis nigricans. Now what is this? There is a black discoloration of the skin over here, the nape of the neck and other high friction areas of the body. So this is a very early sign of insulin resistance. It means that your body is not able to digest the sugar that you are taking very nicely, and there comes insulin resistance and then progresses to diabetes. Next, let me talk about pain in the right upper quadrant, that is somewhere over here. So this is where your liver lies, and this can be a symptom of fatty liver disease. This comes because of altered lipid levels or cholesterol levels, that we call it as dyslipidemia, and this is also very common in PCOS patients. Now I would like to talk about the signs of hyperandrogenism. What is that? That is increase in the male pattern hormones in your body. So one is acne, the pimples, which is very common, and we all know about that. Then comes hirsutism. Hirsutism is male pattern growth of hair over the face or your tummy, the inner thighs, etc. Then there is alopecia, that means hair loss, extreme thinning of hair and hair fall. And this finally leads to male pattern baldness, that is the hair from these areas will go away first. Okay, next, increased or long-standing PCOS for many years leads to increase in endometrial cancer, diabetes, cardiovascular disease, as I already discussed. Okay, now let me talk about infertility. So many of us know that PCOS patients do not conceive naturally. They are not fertile. So why is it so? Because normally what happens is during every cycle, one egg matures and gets released at the time of ovulation, and at that time if you are having sex, the sperm will reach to the tube and fertilize the egg. In PCOS, what is happening is many eggs are starting to grow, right? But none of those will reach to the maturation potential. None of them will actually ovulate or get out of the ovary and into the tube. So when there is no egg available, how can there be a pregnancy? But guys, a very nice thing is the treatment is very simple, just weight loss. So only 5 to 10% of weight loss in such patients lead to the gain in reproductive function in 60 to 90% of the patients. Just try to think about this. Only weight loss can allow you to conceive naturally, right? So nice. Lastly, I would like to discuss about mental health problems that occur in PCOS patients. And this is something that is most commonly neglected, and you shouldn't be doing that. So as I said, it's basically a hormonal imbalance. So there are no happy hormones, and these patients often have negative feelings about their body image, their obesity and hirsutism and acne and everything. So it often leads to anxiety and depression. And then there is one thing called binging and purging. So you keep eating and eating and eating even if you're not hungry, and then you keep vomiting that out. So this is called binging and purging. So guys, if you're having these problems, do not be ashamed of talking about them to your gynaec or your doctor. And mental health is as important or even more important than everything else, and it needs to be taken care of. So my request to everyone who is understanding PCOS, who is suffering from PCOS, is not to just treat your periods, but treat your entire body, because that is more important. And once your body is treated, you get healthy, your periods will automatically come back to normal. Thank you so much, and in my next video I'll be discussing about diet and exercise in PCOD, which is the only good treatment for PCOD. No drugs, no vitamins, nothing will actually help you as much as diet and exercise will do. Thank you so much. Stay connected.